what is their role. We also discussed after hours and an introduction to the lab, and CDPHE and CSU discussed their lab submissions and requirements and in-depth into the testing and kind of some do's and don'ts and what's important in the field for testing. Go ahead, Maggie. So what does today look like? And today's actually going to be really a fun day, I hope, for everybody. So, you know, some of it's going to be a little bit of a review from Tuesday, but most of it won't be. Dr. House is going to go over some logistics, and Dr. Martek will go over animal bites, and then we're going to go into some case investigations. And I apologize, Natalie, I did pronounce your last name wrong. Dr. Marzek will go over animal bites, and then Dr. Newens from Colorado Department of Agriculture will go over some livestock case investigations. We'll have some case investigations from some of your public health colleagues, as well as case presentations from Department of Public Health, Department of Agriculture, and Parks and Wildlife. So there's going to be some really cool cases, some videos. And then I did want to discuss really quickly the certificate of attendance, because that was all me on Tuesday. And I know some of you maybe received 1, 2, 3, or potentially even 4 certificates. And so I do apologize for cluttering your email box. Today, Becky will drop that link into the chat prior to the end of the workshop. And if you fill out that Google Doc, hopefully today you'll just get 1 certificate of attendance. So I do apologize for cluttering your email box with that, and I do hope that that I have that fixed for you. I'm going to pass it over to Becky, who's going to go over some of the logistics of the meeting, and hopefully, you know, if you have any questions on how the meeting works, that sort of thing, she can answer those for you really quick before we get started. But thank you for being here. We hope this is a great workshop for you, and we look forward to your comments and feedback.
Good afternoon, everybody. We're having a few more technical difficulties today than we did on Tuesday, unfortunately. I apologize for those that are hearing those dings. They are from people wanting to enter the call, and that comes through on all of the host computers. So whoever is speaking, that's whose computer you're hearing it from, and it will go away. It looks like our folks wanting to join in have slowed down, so that should diminish considerably. Okay, on Tuesday, if you were here, we had a couple of different ways for you to ask questions. Those still apply. You have the Q&A option at the bottom of your screen. You also have the chat option, and those would be the preferred way. The raised hands, unfortunately, are a little bit difficult to see in a crowd of this many, which is a great thing. But the chat and the Q&A are definitely the better ways to get your questions asked. We don't have any poll questions right now for today. If those pop up, we'll definitely be announcing that. And again, those you'll find in the lower right-hand corner of your screen. This is being recorded, and the recording will be available. The recording will be available tomorrow. The problem is some of you have systems that don't play well with Google to watch those recordings, and so we are looking into alternative ways to get that available to everyone interested in that. Just, you know, shoot us an email if you don't hear back from us, and we will get that to you as quickly as possible. Maggie or Morgan, can you think of anything else I might have missed?
No, I think, Becky, that's good. I think just a few brief reminders on that previous screen. Please keep your mics on mute, and this is the button to do that on the bottom left. When it's red, that means you are on mute. If it's gray, it means you are not on mute. And then just to preserve bandwidth, keep your video off if you could while the presenters are presenting. So when it's red, your video is off. That is a little bit less distracting for our presenters as well. So just we're going to try to use today the chat box for questions. Last on Tuesday, it was a little bit, back and forth on both, but in the chat, us as co-hosts and presenters can respond to those questions as well. And we'll try to do that throughout the meeting. And we're hoping to leave time at the end for questions and discussion. We'll try to get through all the presentations and then leave time at the end for additional questions and discussion. And Becky, on the recording, I know some folks do have access to the Google Drive recording. Some people can't actually access that. So we are working on trying to get that made publicly available, and we will include all of this information in the after workshop email that we send out. Becky, anything else on logistics, or Morgan?
No, I think we're good. I think we can get started.
Great. So again, big thanks to everybody for being here today, and the important role that you play in rabies control and protecting human and animal health. Hopefully this will be a really good build from Tuesday, and I think I'm going to go ahead and stop this screen share, and we can get started with the first presenter, who is Dr. Marzek.
Okay, I'm just pulling up my presentation. Hold on 1 second. I don't know if I realized I was first.
Sorry, Natalie.
No, it's my fault. All right, let's see. Okay. So can people see my, okay, here it goes. Can people see my slides?
Yep, looks good.
Awesome. Full disclosure, my internet provider is kind of slacking recently. So if I cut out, I will be back as soon as I can. So I'm going to give a hopefully brief overview about investigating animal bites, specifically for local public health departments and animal control officers, keeping in mind that every animal bite seems to be a little bit different. So there is no way this is going to be an all-inclusive 15-minute presentation. You will still be doing a lot of calling other people for consults. Okay, so I'm going to go over why animal bites are of interest to us, a brief overview of human exposures, as well as domestic animal exposures, and then some additional information. We call them pearls of wisdom in medical school, so there's some rabies pearls there at the end. So why do we care? There's a couple reasons why rabid animals and animal bites might be reportable. And one of them is so that we can, when we're doing risk assessments, we can establish risk. So animal testing helps us know what's going on in what part of the state at any given time. So we learn about epizootics. Those cities or counties that have had skunk epizootics know that basically takes over your whole summer. So it's nice to see that coming if possible. We also can get an idea of the geography of regional variants, which also helps assess risk because bat variants of rabies are transmitted kind of differently than terrestrial variants of rabies based on the ecology of the species that are reservoirs. And this map here is showing I'm pretty sure it's a current map of South Central skunk variant rabies in the state. So this is all the way back from the introduction of skunk rabies into our state through this past summer. And you can see that it's encroaching on the foothills here, but has not yet gone over the mountains. Another reason we care is because we can prevent a disease here. So we can assess domestic animals that have been potentially exposed to rabies so that we can decrease rabies infections in those animals, since they are the most likely to infect a human because they're the animals that we're in closest proximity to. We can also prevent possible exposures if an exposure hasn't happened yet, if we're getting reports of animal activities, particularly things like bat colonies in in multifamily housing, apartment buildings, rental properties, research facilities that can help us intervene before people have an exposure that would be concerning for rabies. And then if an exposure has already occurred, we can perform risk assessments to determine if rabies post-exposure prophylaxis should be recommended to a person. So one of the tricky things, I guess, that I've learned about rabies is that we talk a lot about animal bites, but a bite is not the only way you can be exposed to rabies. So I'm trying the best that I can to refer to rabies exposures as opposed to animal bites, because I think it reminds me, at least, that especially with bats, a bite isn't all that you're looking for. Much more can encompass an exposure. Okay, so digging into human exposures. Humans exposed to domestic animals. In Colorado, this is generally a low risk of rabies transmission. The dogs, cats, and ferret bites, and these are owned domestic ferrets. The 10-day bite hold is the gold standard. There's no indeterminate outcome of a 10-day bite hold. Either they're healthy or they are neurologic and need to be euthanized and tested. The animal's vaccination status does not matter for this 10-day bite hold. If they're transmitting rabies at the time of a bite, no matter their vaccination status, they will be dead within that 10 days, or at least extraordinarily ill, obviously ill. Note that not only is this 10-day bite hold mandatory based on the state statute, it performs better than euthanizing and testing a domestic animal instead of doing the 10-day bite hold. And this is because tests can be indeterminate, but the 10-day bite hold will not. So if you do need to euthanize an animal for humane reasons before a 10-day bite hold is complete, just know and counsel the bite victim that you may not know for sure if this animal had rabies or not. You may not be able to rule it out fully, although if you were able to do a 10-day bite hold, you might be able to if it was healthy at the end of the 10 days. Please also note that the 10-day bite hold does not apply to hybrid animals. So wolf dog hybrids, cat hybrids, there's not been any research done to prove that rabies progresses as quickly in those animals as it does in dogs and cats. And we also, well, I'll get into the vaccination issue on the next couple of slides. But keeping in mind the important things, the 10-day bite hold, euthanasia is not necessary, and the animal's vaccination status doesn't matter in this situation. If the domestic animal that bit the human is livestock, then if there's no concern that the livestock is currently rabid, there's been no exposure recently, there wasn't a dead skunk found in the horse pen or something along those lines, a 14-day bite hold can be done. We basically have extrapolated from the domestic dog, cat, ferret research that a 14-day bite hold is likely to be effective. If the livestock animal may have been exposed, we need to get the Department of Agriculture involved as soon as possible so they can evaluate the risk of that livestock animal. Okay, humans versus terrestrial wildlife. Skunks are our main terrestrial rabies reservoir species in Colorado. Right now, only in the Eastern Plains up to the foothills, but eventually we expect that they will be all across the state. So even though skunks are our main terrestrial reservoir species, non-reservoir species can be infected, particularly raccoons, coyotes, foxes, other carnivores. And then you can also see terrestrial animals, including skunks, that are infected with a bat variant. So we have seen a handful of skunks in the Southwest where there's not been documented endemic South Central skunk variant. We have had positive skunks there, and they have tested positive for various bat variants of rabies. So just because you don't live in a place where skunks, South Central skunk variant is present, doesn't mean you might not have a rabid skunk. So when it comes to wildlife, if wildlife versus human, we would like to test that animal whenever possible, because there's no quarantine period for a skunk. If the animal is not testable, in most cases, a recommendation for rabies post-exposure prophylaxis will be made by public health. Okay, people versus bats is kind of a whole nother animal, as it were. So proximity while unaware is considered an exposure to a bat. So this is the main reason I don't like to say animal bites as rabies risk. So if you're sleeping in a room with a bat, if you wake up and there's a bat in the room with you, if somebody has witnessed you unconscious in proximity to a bat, or if you are too young or unable to reliably report if you've had proximity to a bat, those are all considered exposures. And the problem is that bat bites may not be evident even if the person is aware of the presence of a bat. So for instance, there in one of the headlines that Drs. Baldwin and McCarty just showed, there was a case in British Columbia of a gentleman who died of rabies, and his exposure was that he'd been walking outside and a bat flew into his hand. So he was, paying attention, he was fully aware. Bat flew into his hand, he felt it touch him, but he didn't feel a bite. But we assume that a bite occurred because he subsequently, unfortunately, died of rabies. So if there is an exposure where there are many bats that could potentially have exposed a person, there's no need to test because we can't guarantee that the bat that we test is the one that did the exposing. And in those situations, we recommend mitigation because usually there's a problem where the bats are getting into the living space, and post-exposure prophylaxis is usually indicated. If it's a matter of one bat that managed to get in when somebody was opening the door in the evening, then the best thing to do would be to test that bat. Okay. Domestic animal exposure. So if you have a livestock versus wildlife situation, the Department of Agriculture needs to be made aware. They are the ones with the authority to determine the disposition of the exposed livestock animal. Testing the wild rabies suspect animal is always preferred. And then it's important to know, just because we know for sure that that the cow was bitten on the nose by that skunk in the field, we also want to know, were there any dogs in the field as well? Were there any people who might have come in contact with this skunk? Did anybody kind of corner the skunk and maybe touch it to get it away from the livestock? Did anyone clean wounds on the livestock that might have saliva in them? Or did somebody, bash that skunk over the head with a shovel and get brain material in their eyes? Like asking all of these questions is important to determine how many people may have been exposed. Pets versus wildlife. So in this scenario, when it's the pet that's been exposed and not the pet doing the exposing, their vaccination status does matter, and the disposition of the animal will depend on their rabies vaccination status. Additionally, the animal needs to be vaccinated within 96 hours of that exposure, about 4 days. If the animal was unvaccinated and that initial post-exposure dose isn't given within 96 hours, the quarantine may be extended by as much as 60 days. And this is because the research that's been done showing how protective rabies vaccines are in domestic pets, all of the post-exposure vaccination series were started within 96 hours of the exposure. So one of the problems that we'll run into is you have an owner who says, oh, I'll just wait and I'll get him vaccinated once we know that the animal was rabid. But if we're going into a long weekend and it's going to be a couple days before we get that information, it might not be in the animal's best interest to wait, and it might be a better idea just to vaccinate again as soon as possible. If the pet is completely unvaccinated, you are in a situation where the guidelines call for a strict quarantine for 120 days, that depending on the availability of facilities and the capacity in your jurisdiction may be done partly in some kind of a facility. it's a large amount of cost, and the alternative is euthanasia. So testing the wildlife animal that the pet was exposed to is very helpful in the situation where you have a non-compliant owner and you need to enforce that strict quarantine legally. And then if a pet is vaccinated or expired and really will just need a booster dose and a 45-day observation period, testing the wildlife animal may not be necessary, and it would be up to you, your local public health department, and potentially us at the state if the local health department would like some advice. Depends on your jurisdiction's capacity. For instance, if you're in a very rural county and it's very difficult to get specimens to the lab, it involves a lot of time and effort on a local jurisdiction's part, it may not be worthwhile getting that animal tested if the outcome will be the same no matter what. Okay, here are my pearls. So what if there is no exposure? This comes up a lot. So if you get a call saying there's a skunk that's just stumbling around in the middle of my street, I've had my eyes on it, no one's come near it, can somebody please pick it up and get it out of here? The question will become, does that skunk need to be tested? And in some cases, you may want that data for surveillance. You may want to use it for public awareness. So for instance, if you've never had a positive skunk in that part of your county, you may want to test it even if there's been no exposures, just so you can say definitively, we have this here now. If it's your first case of the season and you're going to do some public messaging around this case, that's another great reason. Or if you just haven't had cases in a while and you want a reminder out there that this does truly happen. But if there were no exposures, you don't have to test that animal. If there's any possibility that livestock were involved, I would contact Department of Agriculture, or your local health department, who can then contact agriculture. And depending on the situation, as we heard on Tuesday, Parks and Wildlife may want that animal to test for other pathogens that may not be zoonotic, but they might be doing surveillance. So looping in your regional wildlife office is a good idea if you're not going to test. This is another question we get a lot. Which jurisdiction is responsible for following up a positive animal? And sometimes we have cases where there are 3 counties that could, in theory, follow up. We have the county where the bite victim lives, the county in which the bite occurred, and the county in which the biting animal resides. So our general idea is that the bite victim's county of residence, they have the final say about whether or not post-exposure prophylaxis will be recommended to that bite victim. So they could take the investigation because that is their right, basically. But if they decide that they would like to defer to the county of exposure, and the county of exposure is leading the investigation instead, that's also fine. So it will be very dependent on which jurisdictions are involved and a conversation between those jurisdictions about who is most appropriate to follow up and make recommendations. And the initial assignment in the public health database in CEDARS will depend on what information is reported. So if we get incomplete information in a report, you may learn more once you've started fully investigating. And if you need help figuring out who should be doing what, I'm always more than happy to help if I can. Okay, so this is a shameless plug. CDPHE has started a training series for local public health department staff who are maybe moving out of COVID and back into the world of zoonotics. And the animal bite workshop will be on March 23rd from 11 to noon. It'll be me. I promise it'll be different from this presentation here. The registration link is here in the slides. You can also email Colleen McGinnis and Jennifer House if you have questions, or if you can't find this registration link and would like to register later on. And I can put that link in the chat when I'm done as well. Okay. Oh, thank you, Maggie.
All right. Great. Thank you, Dr. Marzak. I think we are going to jump into now our case investigations. So we're going to start initially with our local, my apologies, local public health folks, and they'll talk through their case investigation process, and it'll be Jessica Royer with Larimer County. And Jessica, we've got a lot of folks on. Okay, there we go. There's Jessica. And Jessica, go ahead and share your screen if you're able to.
Can you give me permission to share?
Oh, yeah, Becky, if you could make that happen. And while we're getting that done, just to give you a little bit of an idea what's happening next, we will be doing case investigation process, primarily focusing on companion animal and human side with local public health. And then we'll jump into some actual case presentations. So we've got another local public health partner that'll be talking in Weld County, talking through some of their case investigations that they did in 2018. Dr. Marzak will come back on. I think she has the most presentations out of all of us. So thanks, Natalie, for that, to talk about a rabid puppy. And then we'll jump into livestock. So CDA will get into the case investigations, how we handle that on the livestock side, and talk specifically about some of our livestock cases, and we'll round out with some wildlife cases. So, all right, great. Jessica, take it away.
Sorry about that. Thank you very much. So just wanted to kind of go through some of our case investigations. Hopefully you can go ahead and see my screen. Just wanted to make some introductions, a little bit about my background. I worked as a certified veterinary technician for many years, and was also a licensed wildlife rehabilitator for several years as well. And then I shifted over to environmental health with Larimer County Health Department. And just kind of a disclaimer, I am working from home. Every once in a while I have a dog that decides he's going to start snoring in the background, so I do apologize ahead of time. But what is our role in public health? We've already kind of gone over this with some of the previous presentations, and this is kind of our role as well at our health department. We do a lot of consultation and investigation of wild and domestic animal bites and rabies exposures, and a lot of education out to our public. So we've got great partnerships within our department, and we have our zoonosis program staff, and we deal with a lot of those animal cases and wildlife exposures, but we also work hand in hand with our communicable disease team. So both of our teams will end up taking these calls, do a lot of those case investigations and risk assessments. And we also couldn't do any of our program pretty much without our collaboration with community partners. So we actually work with Colorado Parks and Wildlife, our local wildlife rehabilitators, Larimer Humane Society, Animal Protection and Control, a lot of agency partners out there that we've worked with that either are reporting these, helping to capture some of the wildlife that needs to, that is being advised to be tested, responding to some of their nuisance wildlife calls that we don't address, and all kinds of different scenarios. So I guess, I'm going to refer to animal incidents. Animal incidences that, some of those things that we get, and it made it very hard to choose one to bring up for this program. We get a lot of different phone calls that come in. We've got a lot of really good outreach that's been done public. The general public knows to kind of reach out to our department if there's something strange going on, or a die-off or things like that. We've had, hey, there's a neurological fox wandering around in my backyard. My dog brought in a bat. I went to open my gate and there was a bat hanging on it and I touched it with my hand. All kinds of different scenarios. So, and then of course there's those baby animal calls. We've worked through quite a few of those and had to assess for risk assessment, and definitely worked with all, our partner agencies in regards to those, with Colorado Parks and Wildlife and Larimer Humane Society Animal Control. Now, zoonosis summary for Larimer, we see anywhere between 200 to 400 incident reports a year in those animal incidences. So also made it very difficult to choose kind of which one to go over today. We do a lot of domestic animal follow-up, and we also, work with those human exposures as well. And it just kind of depends on what's going on. We do have skunk rabies episode, that's endemic in Larimer County. And when that's very active, our calls tend to increase. We'll see more towards that 400 mark. Now, our animal protection and control with Larimer Humane Society has been amazing. Definitely cannot thank them enough for all that they do. They're a local nonprofit that has been in operation for more than 50 years. And they are animal control. They do our animal control contracts for our municipalities and for the county. And they have been just instrumental in being able to kind of help evaluate and, be able to respond to some of these. Some of these wildlife encounters, I mean, they're usually with pets or with humans. Our most common tend to be our skunks and our bats, but we do get a lot of raccoon incidences as well. So that's one of the things that, the incident I wanted to kind of go over today is one of our recent incidences with a raccoon, and kind of walk through how that works when we get one of those type of calls come in. So we actually, and most of these calls like to come in towards the end of day, of course. So we got a call from Greenwood Wildlife Rehabilitation. They had taken a phone call from a couple that had been driving through. They were actually driving through from out of state, heading through our county. And just outside of Fort Collins, they, out in one of the kind of the more rural areas, they actually saw a raccoon on the side of the road and decided to stop and pick it up. And thankfully, Greenwood was able to interview them. They actually had the raccoon. They had grabbed it with their jacket and had it on their lap in the car. And they were able to kind of evaluate, oh my goodness, this potentially is human contact. And they went ahead, advised them to return back to Fort Collins, thankfully, and advised them to give us a call. Now, this raccoon, and it definitely was not a youngster, kind of the wrong time of year for a young raccoon. It was a big adult raccoon. It sounds like it was injured or sick, one of the two. It definitely was not acting normal. And, that's one of the challenges is when Good Samaritans stop and see these guys, they have a tendency of picking them up and wanting to help. Because of the call from Greenwood, we were able to immediately follow up with them. Went ahead and gave them a call, found out where they were located, managed to get them. They headed over to one of our local feed stores, managed to purchase a carrier, somehow managed to get the raccoon in the carrier, which is great. And very, very thankful for our animal control. They were able to respond very quickly. I was able to call dispatch. They were actually able to send an officer out within a very, very short period of time to respond and actually get that animal in custody. We were able to confirm after my discussion with them that we did have some saliva contact into open wounds. Luckily, no bites. I'm not sure how they managed that one. I'm thankful it was a very, very sick raccoon, because otherwise I'm sure there would have been bites involved. But we did have a human exposure. We actually have a great system with our animal control. They're able to submit an online report to us, basically a rabies vector species interview form, if you will. And they're able to just go ahead and enter that online once they get the animal picked up. And we have all of that information. They also assign them actually a case number, and that helps with our chain of custody. And so once this JOT form is actually filled out, it automatically populates, and we track these through our animal incident report spreadsheet. It comes in very handy, especially on those days where it's very busy. But they submitted this form. We were able to get the animal ID number and get the paperwork ready to go to be able to submit this animal for testing. The good thing is with working with our animal control, we have only a couple of staff. We're not able to respond to go get these animals. We're not able to euthanize. We don't have those facilities available. Our animal control is absolutely amazing, and they're able to go ahead and humanely euthanize the animal and potentially get it ready to ship out for testing if need be. We actually have an area at the Larimer Humane Society, which is set up so it's restricted access, and they're able to put those in kind of in the fridge. We have it assigned, it's labeled with that, with that animal ID number for that chain of custody. So we're able to go ahead and just pick that up and then transport it to the lab for testing. Now, the good news with this raccoon, thankfully, because this couple was actually still traveling through the state, is that, they were actually heading back to their home state of Utah, and we were able to actually get that animal submitted very quickly. It was a Thursday. We were able to get those results back actually by end of day on Friday. Thankfully, it was negative for rabies. If it had been positive, it would have changed the scenario a little bit. We would have been in touch with CDPHE and kind of working with them and working with their home state potentially to get them started with rabies post-exposure treatment, which thankfully was not needed in this case. One of the things that we do see, we see a lot of animal cases. This was a really tough one, as I said, to decide. We've had a lot of rabid skunk attacks. I've had a rabid skunk chasing alpacas through a field. We've actually had rabies positive bison, raccoon, you name it. We've had the pleasure of doing some other we've had a couple instances where we had a muskrat bite that we had to kind of do a risk assessment on, lots of bats, and we definitely wouldn't be able to do a lot of these without our agency partners and animal control being able to help respond, take those incident calls, get those forwarded to us, and be able to respond to those in a very timely manner. Now, again, during our skunk rabies, we're not equipped for this. I don't know how these people managed to pick up and get this raccoon into a carrier or managed to contain it on their lap, besides the fact that this raccoon was very sick. But, we definitely utilize our outside agencies, either Colorado Parks and Wildlife or animal control in these circumstances to be able to help capture and obtain these animals. And that's pretty much it. I guess, is there any questions at all? I know I kind of went through that pretty quickly, but that's, we get a lot of these different situations where we'll get that call out of the blue. Hey, we have this going on, and can you help us respond?
Excellent. Thank you so much, Jessica. That was a really great presentation to get that local perspective. And if anybody has any questions, drop them in the chat box. And Jessica, you can respond right in there. And hopefully we'll have some time at the end as well for additional questions. So I think up next we have another local partner that is going to be talking to us from Weld County, where I am right now as well. So I think Christine, are you on?
Hello, my name is Angie Crawford. I have taken over Christine's computer for a little bit. She's going to talk here in just a second.
Okay, no worries. And I just want to make sure, are you guys able to share your screen?
We actually don't need to.
Okay, perfect. All right, I'll let you take it away.
All right, thank you. So Dr. House asked us if we could just talk about a few of our cases from 2018. 2018 turned out to be a really unusual year for us. We had a total of 7 domestic animals that had tested positive. We also had a raccoon that a family was treating as a domestic animal. So that turned out to be also a very interesting case. So I just picked a couple of them. I'm going to talk about 2 of the cats that tested positive, and then Christine will talk about the raccoon. So the first case is Two-Face the cat. We were first notified of this positive by the state. A Weld County resident had submitted the animal directly to CSU for testing. During our risk assessment, we learned that Two-Face had been living on a rural property in Weld County with several other feral cats. 3 of the feral cats, including Two-Face, had kittens that spring. So at this point, there were a lot of feral cats on the property. The family did feed the cats, and none of the animals had any rabies vaccine. Two-Face was described, he was well known by the family. He was described as historically being very skittish. However, about 4 or 5 days before the event, he had actually bitten a child that was visiting the property. And this was somebody that was there for a Craigslist transaction, so it wasn't really somebody that the family knew. But the cat did bite the child and then became very aggressive towards the homeowner, actually charging at him. The family found this to be very unusual behavior just because of the history that they knew the cat. The homeowner actually was concerned that the cat had rabies, but he didn't really know where to call. So he reported us that he had called animal control to pick up the cat, but it doesn't appear that he had actually told them about the bite. And he also contacted CSU, but was not willing to pay for the euthanasia. He did not contact us. On June 11th, the owner the cat did pass away. The owner took it upon himself to drive it to CSU where it was tested and did test positive. So the follow-up on that, obviously the child that was bitten was our top priority, and the child was actually a Larimer County resident. So the folks over there, Jessica and her team, they made sure that the child received PEP. We communicated back and forth with them. Our next concern was the family that was living on the property. There were 3 kids in that household. Thankfully, because the cat was so skittish, there was not a lot of contact. And these kids were old enough that we could trust their report. Also, strangely, this family really knew all the cats. They had 18 cats, and they knew them all and knew which kittens went with which mom, which I don't think would always be the case, but it was helpful for our investigation. The family did in the end decide to euthanize all of the remaining cats and the dog. There was 1 dog on the property that was also unvaccinated. So this actually getting all these animals to have them euthanized was not an easy task. It took us, I say us, but took animal control a couple of weeks to actually be able to get all of the animals. They helped with both capturing and transporting the animals. We had our MOU vet that assisted with the euthanasia. We did not test all of the, I should say we were in close contact with the state during all of this. We only decided to test the 3 kittens of Two-Face, the original positive, and the cats that the children reported having contact with. Only the 1 kitten, who was a kitten of Two-Face, was the only one that tested positive. And she wasn't actually captured until 2 weeks after the mom and was not reported to be symptomatic, but she did test positive. So of interest in this case, Two-Face had no known encounters with wildlife. However, the family did report that she had been missing for a little bit before this and had then returned to the property. This was typed eventually as skunk variant. So it was unfortunate that there were so many unvaccinated animals and that so many animals had to be euthanized. However, we are very thankful for all of our help from our partners to make sure that the necessary response occurred. All right, I have 1 more case to go over, and then we'll have Christine talk about our raccoon. So this second case I wanted to talk about is Misty Blue. That was her name. Again, we were notified by the state that a cat had tested positive at CSU. The cat had been surrendered to the Larimer County Humane Society by the adult son of the original owner. The elderly woman who was the original owner had left town on a road trip, a lengthy road trip. She had been gone for a few weeks and asked a neighbor to feed her 3 cats while she was on this trip. Unfortunately, she was not in good health and she did pass away when she was on the road trip. This was not from rabies. That is something that we looked into. The son and daughter-in-law had gone to the house to clean the house out and also to capture the cats so that they could surrender them to the Humane Society. When they were attempting to do this, the son was bitten by the cat, by Misty Blue. Misty Blue was described as a 16-year-old, extremely unfriendly, indoor-only cat. No vaccination history was available originally. Because of the cat's temperament and age, it was not felt it could be adopted out. The cat was euthanized and tested due to the fact that it had bitten someone within those 10 days. The cat did test positive. So the reason I wanted to talk about this one is this was of interest because this was believed to be an indoor cat only. Obviously, we couldn't talk to the original owner to confirm that the cat had never went out, but according to both family members and the neighbor, this was considered an indoor cat. And at least in the couple of weeks before the event, the neighbor had been coming over to take care of the cat. So it was in the house at that time. No vaccination history was available, but we did end up talking with their vet. The vet had actually retired by this point, but they could still look at the records, and there was no vaccination history for any of the cats. So this is just a great example of why the 10-day quarantine or testing if euthanized within those 10 days is so important, because this is not something that we would have considered highly suspect. Thankfully, because it was an indoor cat, our suspicion just would not have been that high. So thankfully, proper protocol was followed and the cat was tested and we were able to get the individual started on PEP. There was no wildlife reported in the house. It would have been interesting to get a variant typing on this, but I don't believe we ever did. So I think that is it for this one. The other two cats actually did test negative. So I will turn it over to Christine and let her talk about our raccoon.
Hello, I'm Christine Bevelin. I work here at the Weld County Health Department along with Angie, and we have a third person who helps in our program named Cassie. I've been here for about 12 years, and so we've had a few interesting animal encounters or cases that we've worked on, but certainly the summer of 2018 is the most fascinating with the number of domestic animals that we had test positive, as well as our raccoon. So in June of 2018, we first received a phone call from Greenwood Wildlife Rehab regarding a Weld County resident who was caring for a raccoon. The Weld resident had just called Greenwood asking if they could surrender the raccoon to the rehab center, and Greenwood very astutely was able to collect a lot of information from the caller during that initial call. They were able to collect the name, the phone number, address, and some information about how long they had had the raccoon in their possession, which turned out to be several weeks. Our next step was to reach out to the resident and kind of talk to them about what was going on. And so we found out that they had in fact had this raccoon in their possession for several weeks. It was living in their home. They were hand feeding the raccoon and had taken it in when it was fairly young. At this time, the resident insisted that only they and one other adult had had any contact with this raccoon. So we started to explain the concern for rabies and that it's not legal to possess a wild animal. And during this conversation, as you can imagine, the resident had very strong feelings regarding the likelihood that the animal was infected with rabies, and even stronger feelings toward us regarding the need for testing. But we did determine that there was enough contact that testing was going to be necessary in this situation. Next, we reached out to Colorado Parks and Wildlife and requested assistance from them in confiscating the raccoon, and we began to prepare a plan for euthanasia and testing at that point. On a Friday afternoon, of course, it's always a Friday, we were notified by Colorado Department of Public Health and Environment that the raccoon had tested positive for rabies. We immediately reached out to the resident, who was very shocked, had not in any way expected that this raccoon would test positive for rabies. When we were confirming the details regarding the potential exposures and trying to talk about treatment and options, the resident confessed that we were not originally given the full picture of what had happened with that raccoon. This raccoon was a novelty to this family, and they, it turns out, had taken this raccoon to a lot of different locations and passed it around among family and friends, adults, children, all kinds of people. So we decided that we needed to go ahead and initiate a pretty lengthy contact investigation and reach out to any individual who had had any contact with that raccoon and talk to them about what level of exposure they had and their children, and go ahead and start assessing that. We did need to involve the state health department. They were very critical in helping us determine what we would consider an exposure and what time frame we were looking at, since this raccoon had been in their possession for so long. We did also incorporate our communicable disease team here at Weld County Health Department because we had so many people that needed to be reached out to in pretty quick turnaround. So it was a late night, and we were able to, in the end, determine that there were 21 individuals that needed to be referred for post-exposure prophylaxis treatment. This did include a young child in the original household who had reportedly sustained a scratch to the eye from the raccoon pretty shortly before we were made aware of it and the raccoon was tested. So definitely is a pretty significant exposure there. One of the lessons that we learned from this experience is that when we're having that initial conversation with someone who has taken in a wild animal and is in their possession, it's pretty important to be very honest with them about the risk of having contact with that wild animal. Not that we're necessarily trying to instill fear in people, but that we want them to understand why it's important to give us, a clear picture of what their exposures are and what the potential repercussions are. This raccoon did not have any red flag behavior that was reported to us as well. So it's also, I think one of the things we learned was to let people know that rabies doesn't always look like what they may think it's going to look like. Sometimes people have this idea of this crazy, aggressive, deranged animal, and rabies doesn't always look like that. And so it's important to let everyone, let people know that when you're having those risk assessment conversations. Later on after the initial conversation, one of the family members did report to us that the initial call to Greenwood to surrender the raccoon was because the raccoon was starting to become more aggressive with the family members. But that was not something that was conveyed during our initial phone call at all. Partnerships are just so important to us. Without Greenwood and Colorado Parks and Wildlife and CDPHE, we would not have been able to test this raccoon and find out that these people had been unknowingly exposed to rabies. So in summary, 2018 was a very busy year for us over here in Weld County. We had 8 positive bats that year, 13 positive skunks, this positive raccoon, 1 positive dog, and 6 cats. Not a typical year for us, but when we were reviewing these cases, particularly regarding the domestic animals that had tested positive in the raccoon, one thing we did notice is that not once during those cases was public health the first person that was reached out to. So these calls, a lot of times they go to a wildlife rehab facility or your animal control, veterinarians, sometimes healthcare professionals. So it's just really a good reminder for us that we need to make sure that we know who our partners are and that we're working closely together with them and that they know how to reach us and when to reach out to us to discuss some of these situations. And that's it.
That was excellent. Christine and Andy, thank you so much for those presentations. And I think, this workshop is the whole reason that we're doing this is because those relationships are so important, and we need to know who to contact and when to contact each individual person. So I know Christine, you and Angie and also Jessica work really closely with Dr. Newlands in our office as our field VMO on the Front Range. So we're thankful for your partnership as well.
Thank you. Us too.
And feel free, Christine, anybody that has questions for our Weld County folks, please feel free to drop those questions in the chat box, and we will get to them and answer them. Christine and Angie can answer those directly as well. And with that, Dr. Marzek is back up for, I think, her final presentation, perhaps, of the workshop. And she is going to talk about another interesting companion animal case.
Yeah, I'm sorry. I don't think I realized I was on the agenda so much. I have to give other people a turn. So this is a case study of rabies in a rescue puppy that happened, I was going to say last year, but I think it was actually 2020. I don't know. The years all, blend together. I have no idea what day it is. Okay, so it was 2020. So around June 17th, 2020, it was a weekend is all I can really remember. A veterinarian contacted our after hours line to report seeing a neurologic puppy in their clinic, and they had concerns for rabies. So we took down the information, recommended that they test, and because it was a weekend, recommended that if possible, it be tested at CSU, who at that point in the COVID pandemic were also moving samples through a little bit faster than our lab was able to. So on the 19th, 2 days later, we got the report from the veterinary diagnostic lab that the dog was rabid and had been submitted by a local rescue group. So fabulous CSU VDL always shares submission paperwork when possible, so we could see that there were at least 3 groups involved in this dog's care. There was a rescue organization, there was a veterinarian who had been caring for the dog at CSU's veterinary teaching hospital, and then there was a family that had recently adopted the puppy. So our goal, the public health goal for any of these investigations, but this one's in particular, we needed to find out who people and pets had been potentially exposed to this dog and do individual risk assessments to determine if rabies post-exposure prophylaxis should be recommended to these people and how to manage any domestic pet exposures. While we're doing that, we're also providing the exposed people with a lot of information. So information about rabies infection, about post-exposure prophylaxis protocols, how we determine risk, and answering any questions they may have. And then we're also coordinating between agencies both within Colorado as well as other states if needed to ensure that all potentially exposed people and pets have appropriate follow-up. So this investigation started out with, we had the rescue organization's name, so we started with them, called the rescue, and asked for a bunch of things. So we asked for full contact information for all staff and volunteers who could have had any contact with the puppy. We wanted the names of any veterinary clinics the puppy was known to have visited in the 2 weeks prior to its death. We wanted the names of any known members of the public who potentially had exposure to the puppy, and any out-of-state residents. So we want lists of whoever they can think of who might have had contact with these puppies. We then reached out, there was only one. We then reached out to the affected residents' local health departments to loop them in on the situation and to determine who was going to interview who. And then when I heard that there were out-of-state residents involved as well, I contacted the Oklahoma Department of Public Health to loop them in and give them the information about their residents so they could be contacted. So after many hours on the phone with various people, we were able to establish this timeline. So on June 1st, the puppy was found in a field behind an Oklahoma family's home. They took it in and surrendered it to an Oklahoma rescue, and the puppy was fostered in Oklahoma for about a week. On the 8th, the puppy was seen by a veterinarian, received a health certificate, and that same day, a Colorado rescue volunteer, who I'm calling Volunteer 1, took that puppy with some others and transported it to Colorado by car. On the 9th, the puppy has arrived in Colorado and it's placed with a foster family. On the 11th, so 2 days later, the foster family noted that the puppy was licking the inside of her leg and her vulva area. They were concerned she might have some kind of an infection. Puppy was brought to Animal Hospital A on the rescue's recommendation and was given antibiotics for a urinary tract infection. On the 12th, the puppy seemed to be better. The adopter was contacted. The adopter was agreeable to completing the antibiotic course for the UTI at home. So then on the 13th, that puppy went home with her adopting family. 2 days later, the adopter calls the rescue with health concerns, and I'm not sure exactly what those concerns were, but the rescue did refer the family back to Animal Hospital A, where the puppy was noted to be mildly lethargic and have mild weakness in her back legs. She was treated with a steroid injection, they drew some blood, and then the pup was sent home to wait for the results. The next day, the adopter called the rescue back again and said the puppy is now completely paralyzed in the hindquarters and extremely lethargic. They asked the adopter and family to bring the pup into their offices. They did. They did a snap distemper. It was negative. The rescue then referred to Animal Hospital B, where the puppy was admitted and observed overnight. The next day, Animal Hospital B calls the neurology department at CSU's Veterinary Teaching Hospital with concerns about this dog. And CSU agrees to take this dog in for a workup. So Volunteer 2, for the rescue Volunteer 2, picks the puppy up at Animal Hospital B, transports it to the rescue office. Volunteer 3 picks the puppy up at the rescue office and transports her to CSU. She was evaluated at CSU. Relatively quickly, the veterinarian determined that she should be euthanized for medical reasons. They did do distemper testing, which was negative, and it was around here that we were alerted to a suspect rabies case. On the 19th, the result came back positive for rabies, and the CSU clinical staff reported the positive to the rescue. They recommended starting a list of potentially exposed people because they knew that public health was going to ask for it. They then recommended that anyone with direct contact with the puppy go to an emergency department for post-exposure prophylaxis. They then reached out to the adopting family, recommended that they get post-exposure prophylaxis. So the rescue staff then contacts their employees and volunteers, and they make recommendations for post-exposure prophylaxis. The rescue called the Oklahoma rescue and foster family in Oklahoma and recommended that they get post-exposure prophylaxis. And then the rescue was coordinating with a local hospital to determine if any of their other employees needed post-exposure prophylaxis. The rescue was also notified Animal Hospitals A and B. And all this had happened by the time CDPHE had received the lab report and contacted the rescue to start the investigation. Okay, so in the end, 9 members of the public, 8 rescue staff or volunteers, 16 veterinary clinical staff, and 18 CSU staff were evaluated in Colorado. So 57 Colorado residents across 6 counties were evaluated. Then there were 11 residents in Oklahoma who were evaluated by the Oklahoma Department of Health. So in total, 68 people in 2 states were potentially exposed to rabies because of this puppy. Okay. So have some lessons learned from this one. One of the big ones is that public health really needs to be involved ASAP. This one occurred, I think it was like 4:30 on a Friday. It was like classic textbook rabid puppy. But the sooner we're involved, the sooner we can start making post-exposure prophylaxis recommendations, doing risk assessments, answering questions, and making sure that we have enough physical product to be able to give everyone the rabies post-exposure prophylaxis. Recommendations regarding medical treatment, since rabies post-exposure prophylaxis is a medical treatment, those recommendations should really only be made by a public health professional or a physician. Animal control officers and veterinarians, if they wish to, or you wish to perform rabies risk assessments and start getting that conversation going to get an idea of who is most likely to have been exposed, documenting that information and then passing it off to the public health staff member who will be doing a formal risk assessment, we very much appreciate that. But I get concerned when people other than public health staff and physicians start making recommendations regarding medical treatment because of the legalities and all those fun things. Pre-vaccinating staff and volunteers could be considered by rescue organizations. I know that's a big ask when it comes to funding, etc. But it is, just because you're dealing only with dogs and cats that are coming from within the country doesn't mean you're not going to be exposed to rabies. And rabid puppies don't only come from other countries. We hear a lot about the dogs being imported from other countries with that break with rabies once they've that break with rabies once they get here. But it happens in our own state. And it turns out this puppy was, I think it was South Central skunk variant, and originated in a part of Oklahoma where there is known South Central skunk variant circulating. I think that's all I've got on that.
Excellent. Thank you so much, Natalie. That is a very interesting case and a very interesting timeline. So we are going to shift gears from companion animals into livestock and livestock case investigations. So we have Dr. Ken Newens, our Front Range Field Veterinarian with the Colorado Department of Agriculture, and he's going to walk through what livestock case investigations look like from a field perspective and the risk assessments that we do on the livestock side. And then we'll jump into hopefully we'll get at least one of our livestock investigation presentations in, and then we'll do wildlife. So Dr. Newens, if you are able to share your screen.
I am working on it. I sure am. Let's see. It says I can, but yet it is not. What is going on? Let me try it this way. There we are. I think we're going to win here eventually.
Okay, perfect.
And now I'll just put this on slideshow and we should be there. All right. That's pretty good for an old non-technical guy. Thank you, everybody, for attending today. I'm Ken Newens, and I'm a field veterinarian with the Colorado Department of Ag. My area is basically Larimer, Weld, Boulder, Jefferson. Traditionally was that area, along with Denver and Western Adams and Arapahoe County. That has changed recently, but I do an awful lot of rabies investigations involving livestock, and my thanks to my colleagues in Larimer and Weld and also in Boulder County. We talk to each other an awful lot. Sometimes we go out and work together in the field, and it's really nice to have those partnerships with those people. Dr. Marsek is right in the middle of it from the office as well, so we really do appreciate the level of cooperation that we've had. The bottom line is, as far as CDA is concerned, we're concerned with animals on the place that have hooves. And my goal when I do a visit to a property is to, number one, protect the people. That's, with rabies, that is the absolute priority every time you go out. Second, we want to protect the livestock, and we want to do both by preventing any further exposures or any spread of the virus. And then my last goal on a commercial operation is to maintain business continuity if that is possible. There's some challenges with this. There are a lot of moving parts in these rabies investigations, as you've already heard and seen. We have multiple agencies. Sometimes we have multiple owners. Sometimes we have neighbors, and sometimes we're in the middle of a neighbor dispute. Quite often with livestock, we run into the challenge of owner-administered vaccinations. We have pasture animals, and we also have some degree of administrative authority challenges on these cases. If any of you are as old as I am, you know who Strother Martin is, and that's the famous scene from Cool Hand Luke, where he says, what we have here is a failure to communicate. So we have labs reporting to CDA. We have the county health departments reporting to CDA. We have me reporting back to the owner and also back to the office and also back to the labs and the health department. And in the middle of all this, sometimes I run into a problem with urban to rural translations. Not everybody that works at a health department grew up walking in a pasture and a cow pen and has been absorbing livestock lingo from age 3 on. So sometimes what you say is not necessarily what I hear. So we have a lot of people, as I said, we have a reporting party that saw the rabid animal. We have a specimen collector that could be a variety of people, as you've heard already. That specimen collector may not be the specimen's submitter. So we have another person in between, as we just saw. And then the local health department is involved, and they will decide which diagnostic laboratory it goes to. Obviously, if it is a suspected rabid livestock species, that animal will most likely go to CSU. All of those people will then report back to the state veterinarian and report back to the submitter and the specimen collector and reporting party. And the field veterinarian, I feel it's my job to report back to absolutely everybody as I go along. Back in the good old days, if you looked at Colorado and who took care of field work, there were 4 USDA employed veterinarians that worked the state and 2 state employed veterinarians that worked in the field, me and Dr. Dan Love. And Dr. Rich Ann Lumpkin is another work buddy. She and I kind of keep the northeast corner of the state somewhat. Well, we're aware of what's going on, we hope. In the meantime, though, this was, like I said, the good old days. Dr. Chavez, who had the southeast corner, retired. Dr. Love, who had the western half of the state, retired. We have a new veterinarian coming on there. And Dr. Clevenger, who had the southwest corner, was reassigned. So now 4 of us cover the state from border to border. So if you're in Trinidad with the rabies investigation, I do need to be notified, and I will come down. But do remember that I live up by Greeley, and it might be a few hours before I can get there. The urban translation problem is not really a problem. I just kind of chuckle sometimes. I was given a report one time of some cows in a pen and arrived at the feedlot that you see on the left. And I don't know how those steers were going to have a baby, so they weren't cows. Cow is kind of the universal description of the generic bovine. And so I don't make fun of you if you say they're cows and they're steers. And sometimes I hear about the actual report was the cows on the right. They were cows in not a pen, but a pasture. So sometimes you have to sort through things. And if I'm driving down the road looking for a pen that really doesn't have a road address, sometimes I find a pasture, but that's okay too. As far as owner-administered vaccine, it is legal for rabies vaccine to be dispensed to the public. About anybody can get on the internet and get a bottle of rabies vaccine to administer to their livestock or horses. Most private veterinarians that I know and deal with a lot do not dispense the vaccine. Some do to their most knowledgeable and capable clients, but it's up to the client once they receive that vaccine to keep it at the proper temperature, make sure the right dose is delivered by the right route of administration, and nobody keeps records when they vaccinate their own animals. Because of that, we as a state agency don't recognize official vaccination except in very rare occasions. And by very rare occasions, I think my only time I allowed an owner administered vaccine was when it was given by a board certified neurosurgeon to his own horse. And I thought maybe that individual, and had the date, had the vaccine lot number all recorded for me to look at. And so in that instance, I did allow one owner administered vaccine. Pasture animals can be a challenge because, number one, they're generally a little less likely to be exposed, although Jessica brought up the alpacas that were being chased around in their own pasture by a rabid skunk. I got to be involved in that one as well several years ago. And it depends on the species and the gender and age of the animal. It really does. I worry a lot about foals and baby calves because they are sometimes far more curious than their grown-up compatriots in a pasture, and will wander over and stick their face down to say hello to a new animal in the pasture. And it depends on the kind of pasture. Is it a small irrigated pasture with a lot of animals in it, or is it 5 square miles of dryland grass? The cattle were 3/4 of a mile away at the water tank, and the rabid skunk was in the corner, and the neighbor who doesn't get along with the people that had the cattle waited until the skunk crossed off his property onto his neighbor's property to shoot it and then report it. And don't laugh, that happened. So a lot of factors go into this. Here's an example. If you can imagine on a warm, sunny summer day, those cattle might be there, but that pasture might extend well beyond the tree line and into the trees and might encompass 3 square miles. Whereas on the bottom, there we do have cows in a cornfield. They're just there on corn stalks to clean that up for a short period of time, and we may have 50 cows on 15 acres. So stocking density can certainly play into our decision-making process as well. I always call it, it's always called a field investigation. I quickly turn it into a risk assessment. And the reason I say that, especially with livestock, is everybody knows what happened to that rabid skunk or raccoon or whatever the last couple of hours of its life, because somebody noticed it. They kept eyes on it until somebody else could come and capture and dispatch with that animal. But nobody's really exactly sure what happened the previous 48 hours when that skunk, for example, may have not been in his right mind and wandering around a little bit aimlessly and absolutely shedding rabies virus. So we have to look at the likelihood of exposure, I should say, versus known exposure. If you walked out to feed your milk cow and you saw a skunk hanging off of her nose, she's pretty well exposed. But again, if the skunk is in the northwest corner of the pasture and your 90 head of cows are a half a mile away at a water tank, we have much lower risk. The age and kind of livestock, we have to look at that, and also the witness credibility. Quite often before I go out to do a site visit or contact the animal owners, the livestock owners, I do have a visit with the public health people who have already been in contact with them, and I get the story from the livestock owner to the public health people, and then basically go out acting like I have not talked to anybody, so just to see if I get a different story than what was told to the public health folks. And I'm happy to say that 99 times out of 100, that doesn't happen. We do get the same story, And sometimes they do tell me a few more details that might help in terms of post-exposure prophylaxis for the people. And that's just always all to the good as far as I'm concerned. As far as administrative authority, and this is a little frustrating for some people, you know, if we do have disease confirmed on a property in livestock, or the high degree of probability of exposure to the livestock in the case of rabies, we can issue a quarantine, but only on the property where the disease is confirmed in many cases. So unfortunately, it sometimes limits the animals that we can control to the premises on which the skunk was collected, even though it may have walked by several places that have livestock to get there. Obviously, we have testing authority for an area that we would put under quarantine. That just simply can't apply to rabies because of the nature of the test. If we have a skunk on one property and we do have a risk of exposure to horses or cattle on that property, we certainly can't go next door and take someone's $85,000 dressage horse and have it euthanized just because it lives next door. So it does present some challenges. We do try to do a lot of outreach to the neighbors along with our local health department colleagues to let them know that there was a wild animal in the area and they should seriously consider vaccinations for that. You've seen this algorithm before yesterday if you were watching, and I brought it up today because I worked just as hard as everybody else on developing this for livestock exposure. And unfortunately, when we go out in the field, it's a nice guide, but quite often it's nowhere near this cut and dry. And the reason it's not that cut and dry is if you look carefully at that second question on the left. First, are there livestock? Yes. Did sufficient contact occur to transmit rabies? That answer is maybe yes and maybe no, but about 94% of the time it's a variation of maybe. And so we have to take those maybes and sort through them and sift through them to see if there is a risk. Sometimes, and we've had this happen, we may have a risk of exposure on animals that are ready to go to harvest. And the USDA's Food Safety Inspection Service is very adamant that if an animal is exposed to rabies, it should be slaughtered within 10 days and within 10 days of exposure. And if not, if that can't happen, then you have to let that animal sit and wait for 180 days. And that's an awful lot of expense to even an individual feeding one steer that they were going to use for home consumption. 6 months of extra feed is going to result in an awful lot of expense and an animal that is way too big for what they were planning on using. In a commercial feedlot situation, that could be disastrous when the animals are going to harvest and they're already losing $110 a head, and now you have to say they have to be fed for another 6 months. So, you know, we have to be very careful and very prudent in what we define as an exposed animal and livestock sometimes. After that, we do try to determine the vaccination status of the livestock, and if it is currently vaccinated, we have a protocol of an immediate booster. If there's low risk of exposure and an expired vaccination, we do a 2-shot protocol. And if the animal is at a very high risk, you saw the skunk bite your horse on the leg, we will do a 3-shot protocol. Or if that horse has never been vaccinated, we'll do a 3-shot protocol and a 180-day quarantine. So that's basically what I do when I go out in the country. And if you have questions, I'll be checking the chat and we'll be hopefully available and have time at the end. And with that, I will turn it back to Dr. Baldwin.
Excellent. Thank you so much, Dr. Newens. And there have been a lot of really great questions in the chat, and I've tried to answer some of them. I think there might be a couple still that need to be answered, so I'll let you work on that now. Next up, we have Dr. Rajan Lomkin, and Rajan Lomkin is one of our USDA field veterinarians that covers the Eastern Plains. Dr. Lomkin, can we get you on audio?
Can you hear me?
We can hear you on audio. Okay, great. And I can go ahead and share the presentation for Dr. Lomkin. And she's going to talk about, go ahead.
Yeah. I apologize to everyone. I came to my office to get good internet service, and it was so good that now my computer is in a 2-hour-long update. And so this is my cell phone that I'm talking on. I hope it comes out well. I'm going to talk to you today about a case that I worked on, and it was an interesting case for a couple different reasons. Ended up having to do vaccination on quite a few horses and mules and donkeys and ponies, and then the miniature horse died. So lots of different equines involved. It started out, of course, as all of these start out, on the Friday evening before a major holiday. This one happened to be Memorial Day. And the case was in, as I like to call it, middle of nowhere, East Central Colorado. It was a premises that had a lot of different equine type critters on it, plus over 100 poultry, 2 octogenarian owners, and a couple dogs. And these owners were considered by the veterinarian really good clients, but they did most of their own work. So he rarely got a call. When he did, they paid their bill. They usually listened to him, and so he felt good clients. Go ahead, Maggie, please. So this is a stock photo, but this is what Fire looked like. He was used. A lot of miniature horses are just pets, but this little guy was a pet, but he was also used to pull a cart, and he was beloved by the entire family. Of course, the octogenarians had several children who also had several children who also had several children. So the great grandkids really enjoyed playing with this little pony, and it was quite the shock when they lost him. Go ahead, Maggie. So initial exam, the veterinarian was called out late Friday afternoon before Memorial Day to come look at this little pony. He just had not been doing right since Tuesday. The owners dewormed him on Wednesday with the thought, well, maybe he's lethargic because of worms, which is not that bad of a thought, really. He became progressively more lethargic, called the vet out, and oh, by the way, they had a mare that died suddenly out in the pasture a week earlier. This little pony was kept in a little paddock run. It was a dry corral, but the mare was out with most of the other on a pasture. So when the vet examined this pony, he found it to be lethargic, had a droopy lower lip. It was able to stand with help, but he quickly lost his balance and staggered back into sternal recumbency. So kind of laying on his chest, and he could stand and walk if steadied, but as soon as you stepped away from him, he basically collapsed back onto his chest. Temperature was basically normal, a little high end of normal, but nothing too exciting there, and everything else was normal. Go ahead, Maggie. So differentials, again, it's springtime, and I've listed all the infectious diseases there, and go ahead and click again, Maggie, please. Oh, well, okay, never mind. There was another part of that chart that actually had toxins on it as well, and honestly, the veterinarian felt like rabies was by far the top differential. He was a little bit concerned about maybe a bacterial encephalitis and or maybe a toxin, because the great grandkids did like to feed this pony weeds. However, that would have been pretty far off, because the last time the great grandkids saw the pony was May 1st, so almost 3 weeks ago. Okay, go ahead, Maggie. Okay, so the vet treated it with injected steroid and antibiotics. Again, thinking about that bacterial meningitis, but his still main concern was rabies. He spent a significant time discussing rabies with the owners. Unfortunately, the owners absolutely refused to believe it could be rabies. The vet requested that the owners call him immediately if this horse's condition worsened. The horse's condition worsened, and the owners did not call the veterinarian. The veterinarian also left more treatment with his staff at the clinic for Saturday morning, so that if the horse did improve on the initial treatment he gave, the owners could come in and get a second set of treatments. Again, trying to save the owners some money. The horse did not improve, but they did go in and pick up the second set of treatments. And so the veterinarian felt like, oh, okay, the horse is improving, great. So the vet kind of stopped worrying about it. And so again, the horses did treat that pony again. And by Sunday afternoon, he was basically completely non-responsive, couldn't get him to eat or drink, and they did go ahead and euthanize him, the owners did, by shooting him in the head. And they still did not call the veterinarian about it. Go ahead, Maggie. Thank you. So that was Sunday afternoon. Sunday evening, the owners found a skunk that was basically unresponsive, just kind of hanging out next to their duck pen, close to the water. And so they shot the skunk in the head and put a tub over the top of it. And by that point, they're starting to be a little bit concerned that maybe the vet knew what he was talking about, and maybe they should be concerned about rabies. So Monday, Memorial Day, they contacted the public health department. It took a little while for them to get through to someone who could help them. Tuesday, public health contacted CDA, and then I went out first, and that was basically late afternoon by the time that went through all the channels. And so I was out there basically at daylight Wednesday morning and removed the heads on both the skunk and the little miniature horse. Took them both up to CSU. CSU found rabies in both of them, and major kudos to CSU because they were both starting to decompose pretty impressively. By that point, it had been a pretty warm Memorial Day weekend. I was truly impressed that CSU was able to get a positive out of those two heads, especially considering they were both shot in the head too. So that wasn't helping anything. Go ahead, Maggie. So our regulatory response, both of the dogs were current on their rabies vaccinations. Both of them, the owners just automatically got them boosted, and that would have what everybody would have recommended anyway. So that went out fine. None of the horses, donkeys, or mules had been vaccinated for rabies ever. And so that was a major problem. I recommended and the CDA did go ahead and approve this recommendation that we vaccinate all of the horses, mules, and donkeys, and ponies, and all of the rest of them, all hoof stock, 3 times, 3 to 4 weeks apart, and put them all in a 180-day quarantine. And had it not been for that mare that had died out on that pasture a week earlier, I don't know that I would have gone to that extreme for all of the horses that were on pasture. I think I probably would have just gone looking at the premises for what was in the paddock area with where the miniature pony was housed. But that mare just kept bothering me that she died out there because she was honestly one of the youngest ones they owned and reportedly in the best of health of all of the ones that they owned. So there was really no good reason for her to just die out there, other than if she had rabies as well. So that was my concern, and that's why I did that rather draconian recommendation. The husband, thankfully, was the only one with significant exposure to the pony. He did receive prophylactic rabies, immunoglobulin, and vaccinations. I'm not sure that he completed his full vaccination regimen, however, because he had some major reactions to that, and I know he got his second vaccination. I'm not sure he did go back and get his third. He was pretty sick from those vaccinations. Next slide, please.
I think that's it, Richanne. That's all the slides I've got here.
Sweet. Okay, good. I wanted to present this particular case because of that extreme denial that the owners had that this pony could have rabies. And unfortunately, that is something that we see in livestock, especially the more pet varieties, the horses, even the cattle and sheep and goats too. And I'm sure that public health sees this, animal control and those guys, that you all see this with pets as well, is that everybody knows that rabies is a death sentence. And so they just go into denial. And even like in a case like this, where it is a significant, the clinical signs are pretty significantly rabid. I mean, this was the dumb form of rabies, but this veterinarian has seen rabies before, and he was pretty darn sure this was what it was. So I think that it's something we all need to kind of think about, try to come up with ways to really pay attention to that concern about rabies, and make sure that they understand that we really need to get those animals tested and get those results, especially if there's human exposure in this case. And that's all I've got on that.
Rajan, thank you so much for that excellent presentation. I think you hit all the highlights on why that was a really good case to share. And just like we heard from our Weld County cases, it's not all of these rabies cases read the book. Rabies actually doesn't really have a great book, and neurologic cases all present differently. And with animals, there's just so many differential diagnoses. So it's really good to have everybody engaged and involved in that. So thanks so much, Rajan. We're going to shift gears again. I think for the last time today, we're going to shift gears to wildlife. And Dr. Fox is going to present on their wildlife case investigations. So go ahead.
Sure. So I'm going to talk about a bat case, but I thought I'd start out by saying I talked on Tuesday and said that if there is no contact with human or domestic animals, CPW is often interested in testing those animals. And one of the criteria we use is an animal that's seen alive showing clinical signs. And it's really helpful if we can get a video. So these are a couple of examples of videos that people have sent us of animals that are showing clinical signs that we say, yes, this animal is certainly showing signs of neurologic disease. And we follow up with an investigation. So the skunk is having seizures. And then in this other panel, we have a coyote that's showing signs of incoordination and disorientation. And both of these animals tested positive for rabies. But the case I'll talk about today actually did have human exposure, and I'll talk about how that came about, since we usually don't take the lead on those. On the left side, that's a canyon bat. It's the smallest bat we have in Colorado, so it's about twice the size of a penny. And this type of bat was being tracked by one of our biologists to test for white nose syndrome. So in that middle picture, you can see he's got nets set up around a pond where the bats are going to be foraging that night. And they go out during the night, and the bats fly into the net and become entangled, like you can see on the far right picture there. And then you can grab the bat out and collect your samples and let it go, and it'll be on its way. But one of these bats, and the biologist noted that this particular bat was notably scrappy while he was handling it. It died while he was handling the bat. And because this was a research project, all of our research projects are approved by an internal animal care and use committee. And one of the requirements is that all capture mortalities be reported. And if the cause of death is not readily determined, those animals need to be submitted for a necropsy to make sure that there's not something about our capture methods that need to be mitigated. So came in for necropsy as a capture mortality. It was an adult female canyon bat. She was in good body condition, didn't have any signs of trauma, her stomach was full. She did have some pulmonary congestion and edema that went along with what the biologist noted as respiratory distress when she died. And it wasn't until I got the histopathology back and saw there was encephalitis that this turned into more than a capture mortality. So obviously a bat with encephalitis. This is a rabies suspect. So contacted the biologist who handled the bat. He confirmed he was the only person who had handled that bat. He was wearing his PPE. He's also vaccinated for rabies. I handled the bat, and my necropsy technician handled the bat. We had also were vaccinated and used appropriate PPE. So after consulting with CDPHE, was determined there were no significant exposures. But we did still want to get the rabies diagnosis. And if you remember how tiny that bat was, you can think about how even more tiny its brain was. So I popped that whole brain into my formalin jar to get a good look at the histopathology, which meant there was no fresh brain for an FA. There is a test that you can do on fixed tissue. It's immunohistochemistry, but the only diagnostic IHC is run by CDC, and it requires a little bit of work to get that done. So CSU generously ran their research IHC for me so I could get a look at whether it was worth sending this on to CDC. And that picture, every bright red dot that you see is rabies antigen that's been recognized and fluorescing. So this bat did look like it was going to be positive for rabies. So then we had to contact CDPHE again because they need to authorize any submissions that go to CDC. They said, yes, of course, send it on. We'd like to know. So we sent the block to CDC and got back the result. Yes, indeed, rabies virus antigen was detected. And the lesson learned for CPW, or I guess we hopefully know this lesson, but maybe reinforced, is that if Dan had let this bat go and it hadn't died in hand, he would never have known that he handled a rabies positive bat. And so all of our CPW staff have to know that they may unknowingly handle animals with rabies. So that's why all of our staff that handle wildlife are rabies vaccinated. We get our titers tested every other year. We handle skunks and bats with thick leather gloves to prevent bites. For bats, we have to wear nitrile gloves that can be either disinfected or changed between bats for our white nose protocol, so we're not transferring any pathogens between bats. So we have to wear those over those big thick leather gloves, but you can see Dan there demonstrating how that's done. And then we added an N95 mask as part of our protocol for handling bats when SARS-CoV-2 came on the scene. So he's got an extra layer of protection when handling bats there too. So that's all I have on the bats. I have that mountain lion if you want, or we can go on to questions.
Let's maybe pause, Karen, just for a minute, and real quick, if we could have Becky or Morgan drop the link in the chat to the certificate, then we can have folks at least start filling out their certificate. I think maybe, Karen, let's see if there are any questions at this point in time. And if we have time for the last case presentation, which is an interesting one, we can certainly give that. But I know there are a lot of good questions that we had in pre-submitted questions, and there's been a lot of good questions throughout the day as well today. So Jennifer or Natalie, if there's any questions you guys have that you wanted to answer right now in some of those pre-submitted questions, we could go ahead and do that. Or if anybody does have any additional questions, feel free to. Okay, looks like we've got one hand raised. Gretchen. Unless that was an accidental hand raise.
Okay, I'm not sure where Gretchen went, but there are more questions in the chat, and it's easier for me to talk than to type. So Melanie asked, is there a recommendation for how often persons with routine occupational risk for rabies exposure need to be revaccinated? So the recommendation is, if you're occupationally exposed, is that you have a rabies titer checked. If you are very frequently exposed, such as our laboratorians who work directly with rabies positive specimens, those individuals should have their titer checked every 6 months. For individuals that are less often exposed, such as veterinarians or animal control officers, should have their titer checked every 2 years. And if the titer is low, they should receive a booster dose of vaccine. If the titer remains good, there is no need for a booster dose, and some people's titer has remained very high for decades. So I do recommend getting the titer checked. It's much cheaper than a booster dose of rabies vaccine. And if you are exposed to a rabid animal, even if you're vaccinated, you will need 2 doses of rabies vaccine given 3 days apart. So I think that answered that question. Did anybody want to ask a live question while I jump over to the chat and read the next couple?
I've got one that I think I can answer from Dr. Bowen in the chat, which was, where can a private practicing veterinarian get their titers checked? So good question. You can, and Jennifer, I think, and you, Natalie, might have a good answer for this as well, but you can reach out to your primary doctor, your primary physician, and most of them can order that for you. That's how I've had mine checked in the past. I also know at some veterinary conferences, there is a booth where veterinarians can get their titers checked. I've not partaken in that before, but at some particular conferences, apparently you can get that done. Is there anybody else that would like to ask a question live? We've got plenty of time for discussion. If we don't have a lot of questions, we can go into the last case presentation too, if people are interested in hearing about the mountain lion.
And I did want to note that on Tuesday, some of you put your questions in the Q&A, and those did not save in the recording. So if you asked a question in the Q&A on Tuesday and it didn't get answered, if you want to put that in the chat, we can address that either live here today, or we'll put it in the email. So I just wanted to note that because there were questions that we didn't get to, but then they disappeared.
And just a recap on that after workshop email that we'll send out. I'm not sure if we'll get to it today or tomorrow, or for sure next week we'll get it sent out, but we'll have some resources and links. We'll have that list of questions with some of the answers and resources directly linked there. And we'll also have some information on the webinar recordings, which we won't have posted quite yet. We need to have our communications director, she's out right now, but our communications director get those updated. Will the certificate cover Tuesday? No, so they were two separate links, one for Tuesday that we had dropped in the chat, the same thing for Tuesday with the 2 hours, and then one for today with 2 hours, because there were some individuals that were not able to attend both. Okay, Jennifer, do you guys want to mention again, just real quick, a plug on that, the March thing that you guys are doing for animal bites?
Yes, so on March 23rd, I believe it's a Wednesday at 11 a.m., Dr. Marzak is going to give a talk on animal bites for local public health personnel. She just touched on it barely a little bit today. It'll be closer to a 45-minute talk on March 23rd if you guys want to register for that. And if you need that information, you can send me an email, jennifer.house@state.co.us.
Excellent. What other questions do folks have? I'm not seeing any come through. So Karen, if you want to, I think we can wrap up in the last 10 minutes and just give this last case presentation and talk about it. People can drop questions in the chat if there are any additional.
Sure, I'll go fast. So this is the mountain lion case that many of you probably heard about in 2020. There was a homeowner in Loveland who was attacked by a mountain lion. At the time that this person was attacked, the FedEx driver was there, and so the FedEx driver assisted this person by hitting the lion with a board. It released the victim then and ran off, and both the victim and the FedEx driver sheltered in the FedEx vehicle until authorities arrived, and that included the Larimer County Sheriff's Office, Larimer County Rangers, and Colorado State Patrol. Those authorities followed the mountain lion to a nearby RV park, where the lion came out from under a trailer, bit one of the Larimer County Sheriff's officers, and then when the Larimer County Rangers kicked the lion and it let go of the Larimer County Sheriff's Office deputy, and multiple shots were fired at the lion at that point in time. The lion took off, left the RV park, crossed the Big Thompson River, where it was when CPW arrived and euthanized the now wounded lion. So we talked about CPW's role on Tuesday. This is one where CPW really does take the lead on the investigation based on that administrative directive that I shared with you. So one of the things they're going to do is an emergency response to any human safety issues that are there. Once those are taken care of, they'll secure the site for the investigation, interview witnesses, collect evidence, photograph the scene. Sometimes they need to collect DNA evidence. In this case, they had to request a forensic nurse from the hospital to collect DNA evidence from the victims. And then they do a ton of documentation. The lion comes to me for necropsy. Some of the things we do are we age and sex the lion, and we take a weight, and we just do a general external exam. In the upper left-hand corner, you can see the lion's head and paws are covered with evidence bags. That's to protect DNA evidence. We'll collect DNA evidence from the claws and the mouth and the teeth. In this case, it had been shot, so we have to do trajectories, radiographs, collect any projectiles. And then after that, we proceed with the general necropsy. So it takes a while, and you are in this lion pretty closely. So exposure-wise, I'll get to that. So rabies testing was part of the disease investigation. So we did order stat testing, which Christy Mayo talked about on Tuesday. We paid for that and got results back within 24 hours of the attack, which was fantastic because it did confirm rabies. So that gave CDPHE a head start on follow-up. We also did forensics on this cat. So to confirm that we did euthanize the cat that did attack those people, we matched DNA. Well, we sent the DNA to the Wyoming Game and Fish Forensics Lab, and they matched DNA from the lion that I necropsied to evidence from the wounded officer. Unfortunately, there was no mountain lion DNA recovered from the first victim, and so that was not definitively confirmed that that was the same lion. Documentation by CPW included their incident report, my necropsy report, the forensics report, and a list of employees we provided to CDPHE of people who had some level of possible exposure for CDPHE to assess. They determined there were only 2 people that required any post-exposure prophylaxis. That was myself and my necropsy technician. We were both vaccinated, both had adequate titers, and wore adequate PPE, but that 4-hour necropsy was enough that we thought that 2-dose post-exposure was appropriate. And then I left some time for other agencies if they wanted to chime in on what they had done as part of this.
Yeah, I can talk a little bit on CDA side. I think it'd be helpful for our public health folks to maybe mention what they did as well. This was an interesting one from CDA's perspective because it was a mountain lion, so obviously not livestock, but we did receive a report that some horses in the same area where this mountain lion had been detected had been attacked by a mountain lion. And Dr. Newens, I believe you're still on. Dr. Newens, it's in his field area, so he took lead on the field investigation on this one as well.
And this was a guest ranch where they had they had a large number of horses, but they had one group of horses in a set of pens and a stable. And we had, I believe, off the top of my head, I think there were 5 horses that were wounded. Of those 5 horses, 3 of them had demonstrable deep puncture wounds on their neck that were quite obviously bite wounds. Several others did have deep scratches and lacerations that were much more likely from claws. And so we treated each of those horses as immediately exposed as well. And one of the horses had to be euthanized just due to the severity of his wounds, but the other horses all survived and came out the other side very well. I think also a very interesting incidental finding is we were worried that there might be more than one lion in the area as well, and Wyoming was also able to isolate horse DNA from the claws of the lion that was submitted. So we had pretty good indication that the same cat had caused all the problems.
Great, thank you so much, Ken. Jennifer or Natalie, do you guys have anything to add on that particular case from public health side?
Yes, from the public health perspective, we were only involved with risk assessments, and the risk assessments was shared by the Larimer County Health Department and CDPHE. So we had a combined effort. There were a total of 35 people who had potential exposures that did have to be assessed on an individual level. Of that, a total of 8 people did need rabies post-exposure, and you can see why. There were a lot of people that had some direct contact. 4 of the people had received rabies post-exposure or rabies pre-exposure vaccine, so that was good. So they only needed the 2 doses of vaccine, and then the other 4 were naive and had not had pre-exposure vaccine. But that was what 35 people potential, and then 8 that we recommended treatment for.
Great. That was a really interesting case with a lot of different agencies involved, and not one of our typical routine cases. Certainly made the media, and I think it just highlights the importance of all of us being connected. Everybody knowing what their role is in rabies control, what their role is in protecting public and animal health in the state. So we really, really appreciate everybody's partnership. Everybody that has attended Tuesday and today, all of you guys have such an important role in the state. And we're hopeful that this provided you some helpful resources, and now who we all are, people behind the phone, people behind the screen. But we're here as a resource to everybody, all of our local partners. And hopefully this is just one of the first of many different workshops we do, because COVID kind of took over our life for a while. There are still other diseases that we're dealing with on a routine basis, and we need to kind of get back into the grind of this disease control, looking at what we do in big picture. So I do see some other questions still coming in. We'll try to get those answered in the post-workshop email. We'll maybe have an attachment with all of the questions and answers and resources that can answer those questions. And we'll include the pre-submitted questions in there as well. So we'd be sure that we're answering all the questions. Usually it's not one person having one question. Everybody has the same questions. So Jennifer, any closing comments from CDPHE?
Yes, I just want to thank everyone for attending. We had over 250 on Tuesday and 225 or so today. That's wonderful participation, and we're glad that you guys were able to make it to this training. And please let us know if you have additional questions after the email comes out that we weren't able to get to. Thank you.
Excellent. Thank you so much. Karen, any closing comments from CPW?
I guess just thanks so much for inviting us and letting us be a part of this. And I'm here to answer people's questions, so don't hesitate to reach out. And we've got some great partners that I already talked to, but I think there's a lot more here that I don't know yet. So don't hesitate to reach out.
Excellent. Thank you guys so much. We'll leave the line open like we did on Tuesday for maybe a few minutes. Make sure everybody's able to grab that link and get a certificate of attendance if you are interested in getting that. But everybody take care, stay warm. I think we're on the backside of this storm that has come through now. So have a great weekend and look forward to working with everybody.